Hello, Kidney Warriors. James here from Dadvice TV, your online kidney health coach. And this is another episode of Dadvice TV Live. Now, for those of you that are new, like Marcia right here, go ahead and introduce yourself. Hey, Marcia, we have a great community, very positive, supportive, and helpful. And for those of you that are new, my name's James. I have kidney disease. I was diagnosed almost 2.5 years ago when I spent a week in the ICU, stage 5. It was awful. But I have worked on diet, lifestyle changes, taking my blood pressure medicine, getting that under control, and improving my overall health, which has helped me to improve my kidney labs. But more importantly, I don't have any symptoms anymore. And if you look at my labs, I'm considered stage 3. Now, tonight, we are going to talk about something very important and very, very timely. We're going to talk about getting your COVID vaccine. I'm on the waiting list, and I'll tell you, I cannot wait until I can get mine here in Ohio. I keep checking all the time, hoping they'll add people with kidney disease to the list, but we're not on the list yet here. And I'm still young at heart too, so my age group hasn't gotten there yet. But to talk about the COVID virus vaccine, the coronavirus vaccine, we have the author of the book every kidney patient out there should own, Learn the Facts About Kidney Disease. We have author and retired nephrologist, Dr. Steven Rosansky. Hey, Doc, how you doing?
I'm good, James. How are you doing?
Hey, doing great. Watching the snow fall and the ice accumulate on the road here in cold and freezing Cincinnati, Ohio.
Yeah, well, my kids are all around the country. I've got one in Denver. I've got 2 in New York City, and those kids in the cold climate are wishing they were in South Carolina right now, where we definitely had some rain, but no ice and no snow. So that's the deal here in South Carolina. But anyway, I guess folks know or may not know about me. I'm a retired kidney doctor. I've published a lot on various aspects of kidney disease, including when's the best time to consider dialysis if you're offered it. And I'm hoping to get people to worry less about kidney disease by being on Dadvice TV. And I spent a lot of my time in the last year learning about COVID. I try to stay real informed. And the reason why I'm doing the show tonight is I just speak to so many folks, friends and people I know that are just vaccine hesitant. And I'm hoping that I'm going to convince some of you that may be vaccine hesitant, don't know where to get the vaccine, how to get the vaccine, what it's all about. And so I think this is a really important conversation. And I'm glad James gave me the opportunity to bring this up with you folks.
Oh, we always love having you on. You're always so helpful and so informative. And I want to do a real quick plug for your book. I'm not here to sell his book if you're new out there, but this is definitely one of those books you guys should have. It's easy to understand. It's so helpful, especially for those that are worried about ending up on dialysis. Dr. Rowe does a great job of talking about the things that matter, what you can do to slow things down. He talks about diet and how important age is in really determining how serious your kidney disease is, as well as keeping an eye out for protein in your urine. That is a huge marker of potential outcome in the future. So I just wanted to mention that right there. Look, we got some people also saying it is cold. Joyce says minus 16 wind chill. I feel sorry for you, Joyce.
My son is in Denver, and he's starting his own trucking delivery business. And this guy's driving his truck on icy roads, trying to make turns on mountains, and having to push like refrigerators up an icy driveway. I mean, let me tell you. He is a strong young fella, my son. But yeah, Denver's got below 0 Fahrenheit. Yep. Ooh. So let's warm up a little bit on the topic tonight. And the first thing, why this is such a hot topic, is roughly 1 out of 3 folks are in the wait and see camp about the vaccine. That's a lot. And I'll tell you why that's a big, big problem. Why people waiting and seeing? One of the problems is the side effects that they're worried about, which we will discuss. And they worry about contracting COVID from the vaccine. Absolutely wrong. You will not get COVID from the vaccine. And in a couple of minutes, I'll tell you just what a vaccine is. And the reason why I think this is a worthwhile conversation we're having tonight, folks, is that people say, who do they trust to give them information? Healthcare providers. I'm not your healthcare provider, but I am a healthcare provider, and I hope that people will trust this information. Apparently, 8 out of 10 folks consider healthcare providers the best folks to tell you about the vaccine. Start out right away. The vaccine, it was amazing that we got it in under a year, 95% effective.
Woo!
And we'll get into some of the subtleties about that 95%, but that's an amazing, amazing amount of protection. 95%, that's as close as you're going to get to 100% with any vaccine. So first, what is a vaccine? A vaccine is just something that uses your own body's natural defenses to build resistance to an infection. In this case, you're building resistance to COVID. It will make your immune system stronger. The vaccines are training your immune system to create something called antibodies when you get exposed to the disease. That's the natural protein that we produce to protect us. Vaccines have been all kinds of types of ingredients. Some have had killed germs. None of them give you the live germ. They do not cause disease. And most vaccines are given by an injection. We've got around 20 different vaccines today. And it's been estimated that these vaccines are saving around 3 million lives a year. They are extremely important. The vaccines are going to protect you from these various illnesses, and I'm sure you folks heard about giving DPT, diphtheria, pertussis, tetanus. You probably heard of MMR. You know, the kids get these vaccines, measles, mumps, rubella. The vaccines will protect you, and a lot of them will protect people around you. And one reason to take these vaccines is there are some folks that are not going to get it very quickly, and they may be, susceptible to COVID. And some people just can't get the vaccine. Like my mom is too confused. I try to get her to come. She's 98. I tried to get her vaccinated. She fought me. And there are young kids that can't get the vaccine. And there are people with certain suppressed immune systems that may not be able to get it. So you're not only protecting yourself, you're protecting other folks.
Yep.
So how does it work? Your immune system recognizes a protein, something that's in the vaccine, to produce the antibody. What is an antibody? It's this protein in your body that will remember a germ and remember how to fight it and destroy it before you get sick. It's that simple. The vaccine contains something in it that produces antibodies to help fight the infection. Now, we'll get into the specific vaccines in a minute, because you guys probably heard it's a new type. It's an mRNA, the one that we're using here in the US and in the UK.
Yep.
So let's briefly touch on herd immunity. Now, I know folks probably think this is silly because, a herd is for animals, but it basically means population immunity. That's what herd immunity means. And when do we get to that point where the population, like people in the US, are going to have herd immunity? If you get a certain number of people vaccinated, and you could also have them have the infection, that you got enough people that are protected, that you'll have less virus being spread around, so that those folks, for one reason or another, that can't get vaccinated, have a low risk of getting sick. That's the point that we're at herd immunity. And how much of the population will need to get vaccinated, it's unknown. it was thought maybe 3 out of 4, and maybe it may be more like 8 out of 10, because there are some variants. This is normal. Viruses mutate, they change their makeup. So the variants are going to make it so that the virus can spread more quickly. And some of the variants could be less responsive to the vaccine. So that's why they're saying we probably need at least 8 out of 10 folks to be vaccinated. And something that you all should be aware of, COVID is with us going forward. It is not going to disappear. It is not going to go away magically. Think of COVID just like you think of seasonal flu. And there are some folks that are saying, and this makes sense, that instead of just getting your flu vaccine, you're going to get the annual COVID flu combination vaccine in the future. So we're going to get into how a vaccine comes about, unless you want to stop here, James, with any question.
Oh, no, we're great. We are doing great.
Okay. So how do we get a vaccine? And a lot of folks said, oh, they rushed this through. They don't trust it. This vaccine, not just, well, we have 2 vaccines in the U.S. right now, Moderna and Pfizer's vaccine. These vaccines have been under more scrutiny in their production than any vaccines in the history of vaccine. There have been all kinds of people looking over the shoulder of the companies that are making these vaccines. And there's all kinds of scientists, healthcare providers that have been looking at the information and making sure that these vaccines work and that they're safe. So how does a vaccine come about to get that stick into your arm? They first test it on animals. They want to see how it works. Then they test it on a small number of healthy people. And they wanted to see if it works. They want to see if it reduces that immune response, and they want to make sure it's safe. That's phase 1. Phase 2, they put it up to a couple hundred people. And in that phase, they're checking out the immune response, they're checking out the safety of the drug, and some of the folks in the second phase get the placebo, so they're getting an idea of how it works. And then you got the real determination of how this vaccine is going to work or not, and that's phase 3. Phase 3, for the 2 vaccines we have in the U.S., had over 70,000 patients tested. Half of them were in the placebo group, meaning they didn't get the vaccine, and half of them got the vaccine. And by the way, if those of you that are socially conscious and want to make a few bucks, you can get online and volunteer for vaccine studies. There are still vaccine studies that are going on. The phase 3, they will test the vaccine in people of all different ages, and in this case, nobody under 18, but everyone of 18 above, lots of older folks, people of color, African Americans, Hispanics, people from all different walks of life. They had a really broad cross-section. So the vaccine's been tested on people just like you. Mm-hmm. Now, what's in a vaccine? The vaccine has what they call the antigen. And we're going to talk about the specific antigen in the vaccines you're going to be offered in the U.S. It's an mRNA. We'll talk about that in a minute. The antigen is what trains your immune system to respond with the antibodies. The other thing in the vaccine is something called an adjuvant, which boosts the immune response. These are all in every vaccine that's been made. Third thing you have is a preservative. You want to make sure the vaccine stays effective. And then you have a stabilizer for some vaccines that you can store long term. A lot of you know that the Pfizer vaccine and the Moderna are generally not real long term, and there are other vaccines that are coming that can be kept for longer term. Every one of the ingredients in any vaccine is tested for safety. So all of the stuff in the vaccines is safe. Vaccines are safe, but they have side effects. The side effects are temporary and they're usually minor. What's the main side effect? A sore arm. The other main side effect, a mild fever. And we're going to get into some more side effects in a few minutes. Severe side effects that folks that are anti-vaxxers are rare. And let's eliminate the anti-vaxxer big issue of autism. There is no evidence that vaccines cause autism. No evidence. In 1988, there was a study on measles, mumps, rubella vaccine. The study was flawed. The study was fraudulent. The study was retracted, meaning the journal took it out of the journal. And the doctor who was participating in this crappy study lost his license. What do we know about the vaccine? We've had 20 different studies that looked at vaccines and whether they cause autism. Large studies across the world. There is no relationship between any of the vaccines and autism. So, a lot of you folks may have kids and you have not been out to your doctor. Don't delay. Get your kids the MMR and the DPT vaccines. Your kids don't want to get measles. They can die from these illnesses, whooping cough. You get them vaccinated, please. Okay.
Yeah, and we got to remember that getting vaccinated, we're not just protecting ourselves, but everyone around us and those that are at risk, like grandparents, those with chronic illnesses, things like that. It breaks my heart when I hear people, and I only hear it online, thank goodness, that are against vaccines, and they're citing data that's inaccurate.
It's fraudulent, it's inaccurate, and the doctor lost their license. I mean, it was just terrible. I could only imagine how many deaths this horrible study, this misinformation caused. At any rate, this is the world today. Social media is producing a lot of misinformation on vaccines. Another reason why I'm here tonight, to try to give you the straight poop. So, who's vaccine hesitant? Well, young kids are, because they feel they're invincible. And we get that. But let me tell you, you don't want to get COVID, because there's a lot of COVID long haulers that are sick for months and years, and we don't know what the long-term effects of COVID are. So please tell your kids, if they get offered the vaccine, to take it and to protect themselves from getting COVID, to make sure they mask up and keep their social distance. The other groups that are at the highest risk of dying from COVID, African Americans and Hispanic, a large segment of those population are also vaccine hesitant. These groups are often frontline workers. They have the highest mortality. They account for the older folks, and people of color account for a vast majority of the COVID deaths. Please don't hesitate to get the vaccine. Vaccines have been tested on people of all races and all ages. Unfortunately, we have our tribes, and we won't get into why, but Republicans are more likely to be hesitant to get the vaccine than Democrats. But please don't let your party direct you to do the right thing. And a lot of folks are not getting the vaccine because they lack information on what the priorities are, which we'll discuss in a minute, who should get it first, second, third, and how do you get yourself lined up to get the vaccine. And we're going to talk about that in just a minute. And unfortunately, I know this from firsthand experience. I know this from my colleagues. I know this from my kids who are healthcare workers. Too many essential workers, including healthcare workers, have been hesitant. I think the hesitation is going down as more. We've had over 1 million people that have already gotten this vaccine. The vaccine does not have bad effects. And you know, we are monitoring any people that are having bad effects, and like I said, bad effects from any vaccine are extremely rare. And people say, well, it's a new vaccine. Well, we know from vaccines that have been produced, there's over 20 of them, if there was going to be a bad effect, all the vaccines that have been produced to date, they happen very early in the first 6 months. So highly, highly unlikely that there's going to be any long term. Nothing's ever 100%, but I can tell you this, there is going to be millions of deaths from COVID if people do not produce herd immunity.
Yeah.
And you got to be careful what's out there on social media. Again, lots of misinformation. And rural folks are saying, well, we don't have to be as worried as this virus doesn't care whether you're Republican, Democrat, rural, or urban. It will get you anywhere. And especially the variants are going to spread. If you got a community that's not vaccinated and the variant just happens to be there in one person, it could wipe out your community. Don't think that you're going to get away from this. You got to get the vaccine no matter where you are. The sooner you get the vaccine, the lower the chance that these feared variants are going to come out in your community. If you got more and more people vaccinated, the virus has no place to go.
Exactly.
To create new variants. Get yourselves vaccinated. Get everybody you know vaccinated as soon as it's available. Mm-hmm. Now, how do you get the vaccine? I want you to write this down. Here are the letters for you to go on the internet. V as in Victor, A as in Apple, M as in Mary, and S as in Sam. You get on the internet with those letters connected to CDC. You all heard about CDC. Mm-hmm. Those letters stand for whatever, the Vaccine Administration Management System. You don't care about what they stand for. VAMS. You go online with VAMS and you'll see a place to click. How do I get the vaccine? You'll get a chance to put in your state because different states have different lists of priorities. And then you go to finding a provider near you to get the vaccine, and it will hook you up to get the vaccine if you are eligible. VAMS, CDC. A lot of people are just real confused, and eventually they'll be at your local pharmacy, and it'll be much easier to know where to get it. But this is the best way that I found if you want to know where the vaccine is available. VAMS, look it up online, and it's connected to CDC.
Yeah, and I'll tell you, so I went to this site earlier, weeks ago. I'm registered both with my county, and here in Ohio, there's no ETA yet on when I will be qualified or eligible for it. But also, I use the HealthMate app through my hospital, and they let me also register there. So when I am eligible, they'll send me a notice there, which is a push notification. So I'll get it on my watch that I'm now, eligible to get the vaccine, so that I can make sure and make an appointment as soon as I'm eligible and get it in there.
James, you are a sharp guy. That's great. And there's going to be more and more resources to make it easier for you to find out how to get the vaccine. But I've just talked to so many people in the last few weeks that are just confused. They don't know how to get it. So that to me is the best way. And James has some other ways. But if you are eligible, try to make sure you find out the best way to get it in your particular area. So why should you get the vaccine? We already talked about how it's going to be 95% effective. It will put you back to normal life, almost normal. I mean, we're probably going to have to continue to wear masks for a good while. We'll get into that in a minute. You want the economy to come back. You want the jobs to come back. And you want to certainly stop seeing 500,000 people dying of COVID, which is what we're seeing in the U.S. This is tragic. And some people don't know folks who have had it. I think most people by now probably do know. And if you know people have had it, you know that's not a joke. And if you know people who have died, it's a horrible way to die, especially when you can't have visitors and so forth. So, what about the myths? There are some really ridiculous myths that people have about the vaccine. And these are all myths. Number one, it's not a live virus. It is not a live virus. No vaccine is giving you the virus. No vaccine, in this case, is going to give you COVID. And there's going to be at least a dozen vaccines that are eventually going to be approved. They don't give you COVID. Another thing, people worry that the vaccine will make them infertile. There is absolutely no evidence that any vaccine will affect your fertility. Absolutely not. A third myth which people have is that don't have money to buy the vaccine. The vaccine is free. The vaccine is free. So there's no reason that you shouldn't be able to get the vaccine.
And actually, I'd like to add one thing to that point. I've heard there are scammers out there pushing that, hey, you can get the vaccine, buy it here. There is no buying it whatsoever. Anyone who's asking for money to get you the vaccine or to get you on the list, that's a scam. Beware of those.
That's very important, James. Yeah, lots of scams.
Yeah, they come out of the
there.
woodwork whenever there's any kind of health crisis or national disaster or anything. It's a shame.
Yeah. So let's talk about when you get your vaccine. People are popping up that they got their first dose. So a couple of things. The two in the U.S. right now, Moderna and Pfizer, you get your first dose, and then about 3 or 4 weeks later, you get your second dose. And you do get some protection after your first dose, but here's something that people have been real confused about, including yours truly. I have heard, and some of you may have heard, of people getting COVID after their first dose. And here's the deal. It takes at least 2 weeks, and probably more like 3 or 4 weeks, before you train your immune system to fight COVID. And if you got exposed in, let's say, the first week, around the time you get the vaccine, you will get COVID. You're not going to have the protection. The vaccine didn't give anybody the COVID. It's because they were exposed, and there's lots of virus out there. So just because you got that first dose of vaccine, you're not protected for at least 2 and probably more like 3 or 4 weeks for some protection. And then the maximum protection after the second dose is about 2 weeks later. Now, one of the things that's being studied right now, and there is a vaccine from AstraZeneca, and that vaccine is also called the Oxford vaccine. And so there's ongoing trials. Like I said, and some of you who are interested may be able to sign up for vaccine trials. And by the way, they do pay a reasonable amount of money. Some of them pay around $700 for your transportation and so forth. So they do pay volunteers in these placebo-controlled vaccine trials. In the AstraZeneca trial, they did test to see after the vaccine if people that got the placebo versus the vaccine or whether they're carrying virus. There is some evidence, and we're going to get more and more of this, that you are less likely to transmit COVID after you've got the vaccine. Not 100%, and that's why still asking folks to mask up even after you've gotten your vaccine. But it's probably, and we're going to get more data on this, you're probably going to be much less likely to be spreading that virus around after you've gotten the vaccine. So no vaccines are live. You don't get COVID. What about if you recover from COVID? Should you get the vaccine? Important question.
That's a good question.
Important question. And here's the current thinking. If you have had COVID, give yourself around 2 to 3 months, not more than 3 months, after you've had that COVID, go ahead and sign up to get the vaccine. So if you've had a COVID virus, it's been proven, you probably got, let's say, 3 months of protection, then go ahead and get the vaccine. So what are these vaccines in the US that we have available from Moderna and Pfizer? They're mRNA vaccine. mRNA, we all have mRNA, we have DNA, that's what we're made of. This is a normal particular part of our bodies. Every cell has this DNA and mRNA. The vaccine is not DNA. You're not modifying your genetic makeup. It's mRNA. mRNA is just something in your cell that teaches the cells how to make proteins. So here's what happens. You got a particular mRNA that will teach the cells to react to the spike protein. And the spike protein, that's why they call it coronavirus, because they got all these spikes on them. The spike protein is what the virus will attach to your cells by. And so you train your immune system to produce antibodies that are at the ready in case the virus comes in with the spike protein. The antibody is going to just go hit it and keep that virus from attaching to your cells and keep you from getting sick. That's how the mRNA virus works. It's producing protein to get the antibodies revved up to keep you from getting sick when you get the actual virus exposed. So what about the rollout? There's a lot of confusion, and it's a moving target, and different states have different folks that are getting vaccinated in different orders. So one thing that's happened across this country and in most other countries is the first folks to get the vaccine were the healthcare personnel and folks in long-term care facilities. And there is good evidence, I'm happy to report, that the deaths from folks in long-term care facilities have gone down remarkably since folks have been vaccinated for COVID. We have had a great response. And the reason why they pushed it out, and I'm sure most of you have heard this, is the highest percentage of the deaths were happening to folks over 75. But there's a higher risk of dying with older age. So the first folks in the first phase were the healthcare facility, long-term care facilities, and the healthcare workers. Then the next phase, which most areas have passed, and we've gone on to the third phase, but the second phase were the frontline workers, firefighters, police, corrections officers, food and agricultural workers, post office, people in manufacturing, grocery stores, transit, teachers, and daycare workers. They were in the second phase, and people over 75, even if you weren't in a long-term care facility. Most folks of most states have moved into the third phase. Most places are in the third phase. So who can get it right now? Most states, if you're over 65, but again, you got to check on your particular state, and when you go on that website, it'll tell you. Over 65, they're offering the vaccine. The other group, which is pretty large, is people under 65, but over age 16 who have an underlying medical condition. And here's where there's a lot of confusion, and I'm not happy about this because the underlying medical condition has not yet included CKD. And we need to raise our voices and scream and yell at the various public health folks in our states. Why aren't we getting offered if we've got an EGFR of ABCD? Less than 60 and certainly less than 30, which, as we'll talk about, you're at high risk. You're at high risk if your EGFR is less than 30. And I talked to my daughter, which is really interesting. I just talked to James about this earlier. My daughter's in Jersey. She happens to be a doctor. She was really worried about her husband because obesity is one of the risk factors for higher death if you get COVID. And in New Jersey, they considered obesity one of the underlying medical conditions. So you got to look at your particular area and see if you have an underlying medical condition that will qualify you. And then it's a lot of confusion about essential workers. I've got a son-in-law who is an electrician. I think he should be able to get it. But if you're in transportation, housing, construction, information technology, I mean, it's just really becoming a much wider group of essential workers. And to me, the essential workers are any folks that have to go to work on the front line. And a lot of folks have the luxury of being able to work from home, like me and James and
Yep.
some of you other folks that are listening. But these people that, if you got to go out to work, I would go out and see if they'll consider you a frontline person, because I think
you're at risk if you're doing a job that requires you to be out there around people. I consider myself very lucky to be able to work from home. I work like this on a camera, talking to people around the United States.
I think it's unfair that that they're not including everyone who has to go out and meet the public. They should all be frontline workers, and they should be in this phase 3, which a lot of areas now are in phase 3, which are 65 and older, and people that are under 65 that are either have a health issue or a front line. So I would push the envelope if I were you and you wanted to get the vaccine. I would ask about it. What about if you're pregnant? This you have to talk to your obstetrician gynecologist. No evidence to date that the vaccine is harmful if you're pregnant. Certainly try to get it before you get pregnant, but if you're already pregnant, no evidence that it's harmful. What about these variants? So the good news is the vaccines in the US and in UK, Pfizer, Moderna, they have some protection that's been shown for the UK variant, which you may have heard about, that's more easily transmitted, and the more feared South African variant. And you may have heard about the AstraZeneca vaccine, which is the Oxford AstraZeneca. And this is one of the vaccines that they were hoping to use in the developing world. It's a not-for-profit vaccine. And by the way, the U.S. is paying for your vaccine. Pfizer and Moderna are for-profit operations. The Oxford AstraZeneca was a not-for-profit vaccine, and it's kind of sad that there may be some difficulties using the vaccine in the South African variant. But to date, the information on these variants is that the Pfizer and Moderna will work. They may not be quite as effective, and we want to, like we said a little bit ago, get as many people vaccinated as soon as possible so we don't allow these vaccines to creep into our population. The more people that are not vaccinated and the more people that the vaccine can pop into and infect, the higher the probability that we're going to get some of these variants. And just to tell you, there's a registry for any vaccine side effects. So we are real time getting information on if these vaccines are causing a problem. If you get the vaccine, any of you who have gotten it know that they ask you to wait around for 30 minutes. There was that fear of the allergic reaction. It was way overblown. It is extremely rare, and that's why after you get the vaccine, they have you sit around to make sure you're not having any kind of allergy. And to my knowledge, this has been very, very rare. Unfortunately, it may be until summer or even the fall before everyone's going to be offered the vaccine. And that's why if you got the opportunity to get it sooner rather than later, so we can decrease the spread of the virus and getting of these new variants. So right now, the vaccine is being studied in younger kids between 12 and 16. And my daughter just told me earlier, Dr. Fauci said that there's going to be a study in elementary school kids, and he's hoping that these studies in elementary school kids will be done so that they can get their shots in the fall.
Oh, that
So
would
with
be great.
yeah, so with luck, everyone who's willing to take it will have this vaccine in the fall, and let's hope that we're going to get back to a much closer to normal life by then. Um, so, what if you get the vaccine? What precautions do you need to take after you get the vaccine? Part of it is how much virus is in your community. Right now, there's too much virus in the community for any of us to change what we've been doing. Continue to mask up when you go out. Continue to keep your 6 feet distance. So for now, continue to mask up, keep your distance, and stay home if you're sick. We're not ready to say that people can, just go out and not mask up. Now, can you get together with people who are vaccinated? Like I'm going to go out on a plane in March, the end of March, to go visit my grandkids, and my daughter and her husband have been vaccinated, so we're all going to be in the same house unmasked. So if once you're vaccinated, you can get together with people who are also vaccinated. No need to mask, no need to social distance. So that's one of the things that you can do at this
That's a
point.
huge benefit right there. That's a step back towards normal.
Yeah, yeah, yeah. Again, the side effects, more common in younger folks, more common with the second dose. But let me tell you, it's a lot better to have a bad side effect reaction than get COVID, no matter who you are. Even young folks are getting long hauler COVID and causing a lot of health issues. And we just don't know how serious these health issues are going to be. Again, you may get a little headache, you may get a little fever, and especially with the second dose. And the last thing I'm going to cover, and this is important because this is a kidney program. What about CKD and COVID?
Yes,
What
yes.
about CKD? What about transplant and COVID? Okay, let's start with transplant. Transplant societies across the world are recommending that even though if you got a transplant, you're going to be on these drugs to get your immune system to not react, these immunosuppressive drugs, they're still recommending that you get the vaccine. It's best to get it, if you're going to get transplanted, it's best to get the vaccine before you get the kidney transplant. That would be ideal. Anybody who is in a dialysis unit and anyone, in my opinion, that has CKD should try to push for that as being a health issue. Most people with CKD may have other comorbidities, but the comorbidities that make you at higher risk of dying are heart disease, diabetes, lung disease, obesity, and people with stage 4 or 5 CKD are at very high risk. So if you can, get yourself vaccinated. And as we said, the potential to die if you're people of color is probably 40 to 50% higher, probably a lot because of your occupations and being front line, but you are at high risk. And please, don't let the terrible history that we have had about people being treated badly in science, people of color. This is no longer the situation. And as I said, the studies have included people of all ages, races, and so forth. The one thing, and the reason why we know that people with CKD are at higher risk is the study out of the UK, 17 million people. There's a graded association between your level of kidney function. The lower your level of kidney function, the higher your risk of dying from COVID. I do recommend, if you can, to take 5,000 units of 125 vitamin D. It's the one thing that I found that seems to make sense. It's safe, and it may give you some protection from getting real sick if you do get COVID. So we got some time for questions, and then I'll talk about some
Awesome.
treatments. I'll talk about treatments if we have time.
Now, there was one question that came up that I happen to know the answer. Someone had asked, are any of these vaccines, have they been tested on people with kidney disease? I know from personally reaching out and talking to Moderna and AstraZeneca that they did include people with kidney disease in their trials. I don't know about the others. So if you're going to get one of the other ones and you're concerned or you're wondering, they've got contact information online, and I found them to be extremely receptive to reaching out to people quickly, because so many people are worried or afraid of getting the vaccine, and we need everyone to realize these are safe and that getting the vaccine is the right thing for you and everyone else.
Yeah. Oh yeah. Yeah. And look, there's no reason why having kidney disease should make the vaccine a problem for you. It makes the vaccine an essential thing for you because, as I said, as your kidney function gets lower, your risk of dying from COVID gets higher. There's no other thing you need to know. You need to get it as soon as you can.
Yep. And I cannot wait for me to get it and for my kids when one's available for them. My kids are very young. They're under 10. But I hope they can go back to school in person next year. They're doing great on virtual, but I know they really miss their friends and playing with them. And chatting in a Google Classroom is not the same as going outside and playing. All right, let's see what we have here. I saw this question come up a few times. Doug is asking, do you think CKD and COVID risk is directly related to vitamin D? I know there's been a lot of chat about vitamin D and COVID.
Yeah, well, that's an interesting question. I don't have the answer. All I know is that there is an association, and they've tested people that have been sick in the hospital. They get their 125 vitamin D levels. And the folks that had lower 125 vitamin D levels seem to have a greater chance of dying. So, it's not a dangerous thing to take 5,000 units of 125 vitamin D. And yes, so some of your viewers are sophisticated. They know that with kidney failure, your ability to make active vitamin D, the 125, goes down. And that's a whole other discussion that we'll talk about when we talk about CKD, bones, and vitamin D, and calcium, phosphorus. But for this talk, vitamin D may be a helpful thing to keep you from dying from COVID.
Yeah, and if anyone's wondering how much vitamin D you should take, talk to your doctor. They'll look at your labs and let you know how much you need to get you to where you should be. Yeah. We've had Sal ask you a couple questions about a mild fever. He is scheduled to get his COVID vaccine, but also get an MRI the following day. And he's concerned that if he gets a mild fever, one of the symptoms, it may prevent him from being able to go in the hospital when they scan his temperature. He's asking, what is the typical mild fever that people are seeing who get the vaccine?
Yeah, so it's going to be unusual to get more than 99 or 100. It's going to be like 99. To get over 100 will be unusual. But there have been unusual cases, like some people just got unlucky. They got the vaccine, they were exposed to COVID around the same time or a few days later, and they got COVID and they got real fever. Yeah, I mean, that's an interesting challenge. I'm not sure what to advise you. If the MRI is critical, maybe you can delay the vaccine another week after you get your MRI. I mean, it just depends on how important it is. Because, yeah, I don't think a fever fever should not stop you from getting MRI. Fever should not stop you from getting MRI. So I don't know the time thing. You probably have to ask your doctor. That gets a little tricky.
Yeah. And then we have, and I don't know if you're familiar with this, but we have someone asking about Sinopharm vaccine.
Yeah,
I've never heard of that.
Yeah. Well, there's vaccines in China. There's vaccines in Russia. And I mean, I'm hearing good things of the vaccines across the world. So I would not I mean, and all the vaccines, I do not know the details of how the regulatory process works in other countries. I know the regulatory process in the U.S. and I think Europe is pretty much very similar, but I can't talk about the regulatory process in China or Russia. But I would say if you got a chance to get a vaccine, get it regardless of what it is. But check on your own about the safety and efficacy of the vaccines that you're being offered. There's going to be probably a dozen before the end of this COVID stuff.
Yeah. Now, Rosie has one that's not directly related to vaccines, but she's asking, can a UTI cause an acute kidney failure?
Yeah, well, okay. So there is something called, used to be called acute pyelonephritis. The more correct term is interstitial nephritis. So it's in the part of the kidney which is not the glomeruli, it's the tubules and the other tissue. A very bad, horribly bad infection in rare cases, very rare, can cause the kidneys to shut down. Let me stay on the COVID thing because there's a couple things that you need to know. If any of you happen to get sick, there is the thing that President Trump got. He got the monoclonal antibody. These drugs could be life-saving, but you got to know that you got to take them within the first 10 days of getting sick. So if you get sick from COVID and you happen to be one of the high-risk people that we talked about, diabetic, high blood pressure, lung disease, heart disease, and even CKD, let's say stage 4 CKD, ask your doctor about getting a monoclonal antibody as soon as you can. Of course, it may save you from going to the hospital and potentially even dying from COVID. So there is treatment out there that a lot of people are unaware of, and some of your doctors may be unaware of. But if you happen to get COVID, try to get yourself hooked up to get, it's an outpatient intravenous through your vein drug, and you can get it in most hospital facilities. We'll be able to give it to you. So that's something that you need to keep in mind.
Very good. I think we've pretty much touched on all of the COVID related questions that I saw. Are there any last tips or recommendations or anything you want to add?
Yeah, so I mean, look, we all want to get back to doing stuff. I think that if you're not vaccinated and you got to go out in contact with people, my recommendation, and I'm not the only one, is to double mask. What does that mean? What I do is I use a cloth mask, and I use a cloth mask over my KN95. The reason for this is that we may have the South African variant that can spread around, and also, the vaccine may be less effective. So we want to try to keep that variant from getting into anyone who's susceptible, to keep it from spreading around. So with the potential for these variants being out there, UK variants becoming the predominant coronavirus, I know in South Carolina, we don't do as much an analysis of the genetic makeup of the variants as they do in the UK. We're starting to do more to see if we've got these variants around. But the best way that I can recommend for you to protect yourself and others from getting these more serious variants is consider double masking if you're going out to be amongst a lot of people.
Yep. And for those that, I actually recently started double masking. I don't go out very often, but it was difficult at first because a lot of the cloth masks that are out there are too small. I recently, about 2 weeks ago, got this one, which is absolutely gigantic. It's made by a company called Tom Bin, Bihn, and it goes under your chin. It covers a lot on the side. It has a neck piece, so you can take it off and it can hang down, plus the earpieces. It is so easy to put on a regular paper N95 style mask underneath, push it against your face, and then pop this over top of it and have that double layer right there. I really love this one because of how thick and how large it is. I kind of was getting worried on some of those small ones. You know, a lot of face showing, not a lot of protect, and they would move when I would talk, and then my nose would pop out, and you got to keep touching. Also, now I'm touching stuff. Yeah. That one, it stays put. I can talk, I can yell, I can run. It's all good.
Let me get to the touching stuff. A lot of folks obsess over wiping things down, and look, you should wash your hands for sure. But COVID transmission through contact is very low. The vast majority of this COVID that's being transmitted is not by touching a surface, although you should wash your hands and you should use the wipes, but be obsessed more with putting the mask on right, not below your nose like a lot of people do. Useless. Make sure your mask is covering your nose and your mouth. That's the best way to protect yourself and others from this COVID virus, because it's transmitted by droplets. That's the main thing, not very much transmission through touch and contact. Still wash your hands, still important, and still distance. And they're saying now with these more serious, more easily transmissible variants, keep further away if you can. Increase that 6 feet if you can, distance from somebody else, and consider double masking. Best way to keep yourself safe and keep others safe.
Yep, sounds great. All right, Doc, we are coming up on the top of the hour. I want to thank you for another great show here. And anyone out there, if you are sitting on the fence about getting the vaccine, get on the right side of the fence. You got to get the vaccine to protect yourself and to protect others. We've got to get enough people vaccinated that this virus cannot keep spreading and mutating, and that way it's not controlling all of our lives going forward. The more we do today, the better, and sooner we'll get back to something close to normal.
Very well said, James. I ditto that. Well said.
Very good. All right. Thank you, everybody. And if you are interested in getting a copy of Dr. Rowe's book, it is called Learn the Facts About Kidney Disease. You can find it on Amazon. Also, there's a link, go.dadvicetv.com/book. That will take you to Amazon directly to it. It is a great book for all kidney patients. And for everyone else, thank you for joining us. And I will be back tomorrow for another episode with renal dietitian Jen Hernandez. See everybody in the next video. Bye.